Good morning, everybody. Today we are going to discuss the anatomy of the tongue. The tongue is a muscular organ present in the oral cavity. The oral cavity is the mouth cavity. In Arabic it is تجويف الفم. The oral cavity is divided into two parts: the vestibule of the mouth and the oral cavity proper. What is the vestibule of the mouth? It is the space of the oral cavity outside the teeth. In other words, it is a space which lies between the gum teeth on one side and the cheek and lips on the other side. The oral cavity proper lies inside the teeth in which the tongue lies. The dorsum of the tongue. If you look at the dorsal surface of the tongue, you will find that it is divided into two parts: anterior big part, which is called the anterior 2/3, and posterior small part, which is called the posterior 1/3. They are divided from each other by a groove, inverted V-shaped groove, which is called the sulcus terminalis. In front of the sulcus terminalis, you are going to find very big papillae, which are called vellate papillae. They are about 12 in number. So the anterior 2/3 are full of papillae, which are called filiform, fungiform, and these are the circumvallate or divellate papillae. The posterior part of the tongue, the mucous membrane is corrugated due to lymphoid collections underneath. You are going to see some elevations here. These are lymphoid collections. They form a tonsil, which is called the tongue tonsil or the lingual tonsil. If we look at the undersurface of the tongue, this is the lower surface of the tongue. This is the tongue is turned up. This is the tip of the tongue here. And if you look at the undersurface, you are going to see in the middle line, this is called the frenulum of the tongue, frenulum linguae. This is a mucous fold which attaches the tongue with the floor of the mouth. This frenulum should not extend to the anterior part of the tongue, otherwise the tongue will be tied to the floor of the mouth, and this will keep it doesn't move freely. Lateral to the frenulum, you can see the vein of the tongue. This is the lingual vein just under the mucous membrane. It looks bluish in color. Lateral to the vein, the mucous membrane makes a serrated fold. This is called the fringe or fimbriated fold. In the floor of the oral cavity, you are going to see this papilla, in Arabic halama. On the summit of this papilla, this is the opening of the submandibular gland. Lateral, this part here, this is the sublingual fold in which the sublingual gland opens. If you open the mouth, you are going to see this is the dorsum of the tongue, upper teeth, palate. This is the hard palate. This is the soft palate, the uvula. On both sides you are going to see the palatine tonsil. Anterior to the palatine tonsil there is an arch or a fold of mucous membrane. This extends from the palate to the tongue. It is called the palatoglossal arch or the palatoglossal fold. Posterior to the palatine tonsil, this fold goes back to the pharynx. This is called the palatopharyngeal arch or the palatopharyngeal fold. These folds enclose. What are the parts of the tongue? We know there is the tip of the tongue, the base of the tongue, which attaches to the floor, the dorsal surface, the dorsum of the tongue, as we have seen. It is divided into anterior and posterior parts by the sulcus terminalis. There is the inferior surface of the tongue, as we have seen before. This is a median sagittal section. This is the mandible, lower teeth, hard palate, upper teeth, soft palate. This is the tongue. What are the parts of the tongue? This is the tip of the tongue. This is the base of the tongue. This is the dorsal surface of the tongue. This is the inferior surface of the tongue. Also, if you look here, behind the tongue, there is a cartilage. This bluish cartilage, this belongs to the cartilages of the larynx. This is called epiglottis. Epiglottis. It lies behind the tongue. If you look at the dorsal surface, this is the anterior 2/3 till here. This is the posterior third of the tongue. And in the posterior third, you are going to see this lymphoid collection under the mucous membrane. This is called the lingual tonsil. What are the muscles of the tongue? We have two types of muscles. Either muscles called intrinsic muscles. Intrinsic means that it lies inside the tongue. They are confined to the tongue and they don't have any bony attachment. So they lie inside the tongue. We have three types of intrinsic muscles: longitudinal, vertical, and transverse. Longitudinal means that they lie from the anterior, from the tip of the tongue to the back, or from the back to the anterior. So they lie along the length of the tongue. When these muscles contract, they shorten the tongue. The vertical muscles, they lie between the upper surface and the lower surface of the tongue. So when they contract, they flatten the tongue. The transverse muscles, they are from the right to the left side or from the left to the right side of the tongue. When they contract, they narrow the tongue. All of these are called intrinsic muscles. We have also other muscles which are extrinsic muscles. We have 4 muscles. They come from bones and they attach to the tongue. all of them are called glossus at the end. Glossus means the tongue. So they are genioglossus. They come from genial tubercle, from the mandible. Hyoglossus, from the hyoid bone. Styloglossus, from the styloid process of the skull. Palatoglossus, it comes from the palate. The first one is called genioglossus. This is the muscle which is called genioglossus. It looks like a fan. It originates here and distributed to the whole length of the tongue. It comes from the genial tubercle here. We have 4 genial tubercles, superior, inferior, right and left. So it comes from the superior genial tubercle. These genial tubercles, they lie on the inner side of the mandible, close to the middle line. So the genioglossus origin from the superior genial tubercle, insertion in the whole length of the tongue. What is the action of this muscle? This muscle, we can know the action by moving the insertion towards the origin. So you can get this part to this part. This means it comes anteriorly, so protruding the tongue. So protrusion of the tongue, this is the muscle responsible, genioglossus. What about the nerve supply of the muscles of the tongue? We are going to find that all the muscles of the tongue are supplied by cranial number 12, the hypoglossal nerve, except one muscle, which is the last muscle, which comes from the palate. It belongs to the muscles of the palate, so its nerve supply is cranial part of accessory. So all the muscles of the tongue are supplied by the hypoglossal nerve, cranial 12, except the palatoglossus muscle, which is supplied by the cranial part of accessory. This is the resume of the genioglossus: origin, insertion, nerve supply, and action. The second muscle of the extrinsic group, it is called hyoglossus. It comes from the hyoid bone. You know, the hyoid bone lies here, the upper part of the neck. It has a body, it has a lesser horn, it has a greater horn. From the greater horn, this is the muscle which is called the hyoglossus. It comes from the hyoid bone upwards vertically to be inserted into the whole length of the tongue. So the origin is the greater horn of hyoid bone, the insertion in the whole length of the tongue. If you want to know the action, move the insertion towards the origin so it depresses the tongue. And the nerve supply, as we have said, cranial 12, the hypoglossal nerve. This is the hyoid bone. This is the greater horn of hyoid bone, and this is the lesser horn. It lies in the upper part of the neck. This is the origin of the hyoglossus, insertion, nerve supply, and action. The third extrinsic muscle is called the styloglossus muscle. Styloglossus means it comes from the styloid process to the tongue. Look at this photo. This is the tongue. Here is the anterior. Here is the posterior. The first extrinsic muscle, genioglossus. The second one, hyoglossus. The third one, the styloglossus. The styloglossus comes from the styloid process of the skull. It is inserted into the tongue, but not in the whole length. It is only in the posterior part and lateral to the hyoglossus. So it is inserted into the lateral posterior part of the tongue. What do you think the action of this muscle? It pulls the tongue upwards and backwards. The nerve supply is the same hypoglossal nerve. So we have the genioglossus, the most medial one, close to the middle line. Lateral to it is the hyoglossus, and lateral also to these two is the styloglossus. Styloglossus origin, insertion, nerve supply, and action. First muscle, palatoglossus muscle. It comes from the palate to the tongue. If you see the hard palate, this is the soft palate, this is the tongue, this is the palatine tonsil. Look at this fold here. It comes from the palate to the tongue. This is called the palatoglossal fold or the palatoglossal arch. This fold of mucous membrane contains the palatoglossus muscle. So the palatoglossus originates from the palate, inserted into the lateral posterior part of the tongue. From which part of the palate? The posterior border of the palate here, and this white aponeurosis. This posterior border is called the crest or the palatine crest and the palatine aponeurosis. This muscle is inserted into the posterior lateral part of the tongue. What is the action of this muscle? Here is also the palatoglossus muscle. This is the muscle here. Comes from the palatine crest, palatine aponeurosis, to the posterior lateral part of the tongue. Action, it can pull the tongue upwards, it can depress the palate downwards. Also, when it is relaxed, it forms an arch, but when it is contracted, it becomes straight, narrowing the space between the oral cavity and the pharynx. This arch forms like a narrowing between the two cavities. This is called the oropharyngeal isthmus. So this muscle, when it contracts, it narrows the oropharyngeal isthmus. What is the origin of the palatoglossus, palatine crest, and palatine aponeurosis? Insertion into the lateral posterior part of the tongue. Nerve supply. This is the only exception of all the muscles of the tongue. It is supplied by the cranial part of accessory. Accessory is number 11. The action of this muscle. Elevation of the tongue. It can also depress the soft palate and narrowing of the oropharyngeal isthmus. What is the nerve supply of the tongue? We have mentioned before about the motor supply of the tongue. The motor supply of the tongue by the hypoglossal nerve, cranial 12, except the palatoglossus muscle, which is supplied by the cranial part of accessory. Sensation is different. We have two parts of the tongue. The anterior 2/3 and the posterior 1/3. The anterior part of the tongue, the general sensation from the lingual nerve, but the taste sensation from the chorda tympani nerve. Chorda tympani is a branch from the facial nerve, cranial number 7. The posterior 1/3 of the tongue, the general sensation and the taste sensation are carried by the glossopharyngeal nerve, which is cranial number 9. What is the blood supply of the tongue? We have taken before that there was a lingual artery, was a branch from the external carotid artery. The lingual artery is a branch from the external carotid. This is the major arterial blood supply of the tongue. What do you know about the course and branching of the lingual artery? This is very important. The lingual artery here is a branch from the external carotid. This is the external carotid artery. This is the tongue. This is the hyoglossus muscle, which comes from the hyoid bone to the tongue. There is a gland just under the tongue. This is called the sublingual gland. And if you look at the lingual artery, this is the lingual artery here. The lingual artery makes an upward loop like this, and then it passes deep to the hyoglossus muscle, and then it passes upwards till it reaches the tip of the tongue. So the lingual artery at first is a branch from the external carotid artery opposite the greater horn of hyoid bone, and it forms a loop upwards. It is divided into 3 parts by the hyoglossus muscle. The first part is before the hyoglossus muscle, the second part deep to the muscle, and the third part after the muscle. What are the branches of the lingual artery? From each part of the lingual artery, there is a branch. So from the first part, there is a small branch here, which passes above the hyoid bone, and this is called suprahyoid branch, and it lies superficial to the hyoglossus muscle. From the first part, there is the suprahyoid branch. From the second part, which lies deep to the muscle, this branch goes to the dorsum of the tongue. So this is called dorsal lingual artery. Usually it's more than one artery, so they are called dorsal lingual arteries. From the third part of the lingual artery, there is a branch that goes to the gland. So this is called the sublingual branch. So we have 3 parts of the artery and 3 branches of the artery. The branches are suprahyoid, dorsal lingual, and sublingual. What about the lymphatic drainage of the tongue? If you look at the tip of the tongue, all the lymph drains into lymph nodes at the submental region. These are called submental lymph nodes. The remaining part of the anterior 2/3 drains into submandibular lymph nodes. They are superficial to the submandibular gland. The posterior third of the tongue drains into the upper deep cervical lymph nodes. So we have the submental, submandibular, upper deep cervical, and the deep cervical lymph nodes, they run along the internal jugular vein, which is the biggest vein of the neck. This is the upper deep cervical. So if you have, for example, a malignant ulcer in the tip of the tongue here, so the patient will come complaining of unhealed ulcer for 3-4 months. You have to know or to diagnose if this is inflammatory or malignant. You have to check the submental lymph nodes here. If they are stony hard and not painful, this will give you an idea it might be cancer. If it is soft and painful, so most probably it is inflammatory. But you are going also to use other methods as biopsy or other techniques to diagnose malignancy. Thank you.